Good morning. Good morning and welcome to the 9th Annual Virginians Improving Patient Care and Safety Conference. My name is Joe Hilbert. I'm with the Virginia Department of Health, and it's been my pleasure to serve as the 2009 President of Virginians Improving Patient Care and Safety, or VBCH for short. VBCH is Virginia's statewide patient safety coalition with a membership drawn from over 40 healthcare organizations. Each of our members has committed important resources to ensure that in Virginia, our healthcare system supports systematic efforts that continuously improve quality of care and patient safety. We strive to achieve this goal through collaborative efforts, through dissemination and implementation of best practices, and through education and training. Before I go any further, I just want to let everyone know and remind them that VBCH really suffered a difficult and tremendous loss earlier this year with the untimely death of Dr. Carl Armstrong following a courageous 7-year battle against cancer. I know many of the people in this room knew Dr. Armstrong personally. Dr. Armstrong was one of the individuals most instrumental in establishing VBCH about 10 years ago. And the strong and steady leadership and guidance that Carl consistently provided to this organization, as well as the warm friendship that he shared with so many of us, will be greatly missed. I'd ask that you please join me in observing a brief moment of silence in Carl's memory. Thank you. One of the concepts that Carl espoused so well over the years, and that is central to the work of VBCH, is that we can and do much more to improve patient safety by encouraging learning and greater understanding from our mistakes. And while we all recognize that healthcare professionals are hardworking and human and fallible, we also believe that most adverse events in healthcare have multiple underlying causes. By paying more attention to these underlying causes, we know we can improve our systems and reduce and prevent medical errors. It is our hope that today's conference provides all participants with fresh ideas and models that can be brought back and replicated and implemented in your organizations and your settings. VBCH is very excited to be partnering with the Virginia Business Coalition on Health for a second consecutive year on this conference. And the theme of this year's conference is Partnering for Quality, Purchasers and Employers Working Together. We continue to believe that a stronger working relationship between healthcare providers on the one hand and employers that pay much of the cost for healthcare services on the other is a prerequisite for further advances in patient safety, quality assurance, and value-driven healthcare. As you can see from our agenda, we have once again assembled an extremely distinguished group of speakers with an engaging series of messages for this year's conference. Now, conferences like this are not free. They do cost a lot of money. Given all of the economic difficulties that everyone's been experiencing this past year, we were very sensitive as an organization to the need to scrutinize all of the expenditures associated with this day. This conference would not have been possible without the generous support of over 30 organizations. In your program, you'll find each of the organizations that contributed to this meeting. Please take a moment and read about them in our program guide. And please be sure to visit our exhibitors in the room next door. We thank each of them for also underwriting the expenses incurred. At this point, I'd like to turn the podium over to Mr. Robert Cramer, who's the Manager of Human Resources Services Planning with Norfolk Southern Corporation and also the Chairman of the Virginia Business Coalition on Health Board of Directors. Bob.
Thank you, Joe. Well, good morning and welcome to our Health Summit. I want to thank each of you for attending this year, and I particularly want to thank those who had to justify this expense to your chain of command. This is an unprecedented economy. Slashed budgets make it very, very difficult to attend programs like this, and all events like this are suffering from participation. And I'm happy to say that we're expecting still over 400 for this session today, so that's really good news. And I think it's because I'm very confident we have a relevant agenda, and we have outstanding presenters. And I hope you'll find that your attendance is well worth your time and your organization's expense. In that regard, I want to thank the Summit Committee and the staffs of both organizations for assembling this outstanding event. This is the second year that the Virginia Business Coalition on Health and Virginia's Improving Patient Care and Safety have joined ranks to present an annual educational event like this. Last year proved that our combined summit benefited both organizations. For our coalition, frankly, it meant more bang for the buck. And it also provided us a venue to expand our footprint in Virginia. The coalition is a group of employers and others who are concerned about the quality of health care in Virginia. So we are here, and we are trying. Initially, we started in Hampton Roads. You can see by our banner, we've been around for 25 years, most of those years in Hampton Roads. So we are seeking to improve our footprint statewide, and a venue like this helps us a lot with that. But in addition to those benefits, I think the most important thing that this summit does is it sets a model, the approach needed to tackle the challenges for healthcare. Today, employer purchasers of healthcare partner with providers and public agencies to bring this summit to you. In the big picture, all stakeholders in healthcare must partner. The old blame game of pointing fingers and talking at each other obviously hasn't and can't work. Progress requires we proceed with recognition of our mutual responsibility for the current circumstances and responsibility for correcting them. An understanding of and a genuine respect for the interests of other stakeholders, and a spirit of cooperation in which stakeholders talk with each other, not at each other. There's no surprises here. How often is improving understanding and communications at the root of making progress on most of the complex issues that confront us? We know with our wellness program that most people know how to live healthier lives. It's just hard to give up our old ways and change our behaviors. In healthcare, it's particularly tough because the stakes for all of us are high, impacting the lives of people and our organizations. Tough because there's so many stakeholders, often with naturally conflicting interests. For me, it's almost overwhelming to get my arms around all the stakeholders and interests involved. A trick that works for me, kind of a Wheel of Fortune approach, is the letter P for partnership. If I was going to solve the healthcare riddle, my first letter would be a P. And why is it P? Well, P is for the purchasers, like Dominion Power, Virginia Beach Schools, Norfolk Southern Corporation, who have to buy health care. Providers, represented in the room today, the hospitals and the physicians. P for plans like Anthem and Cigna and Optima, who we work with to deliver these services. The public agencies who provide regulation, help us with measuring performance, and who also purchase health care. Of course, the professional associations, the PBMs, and the pharmaceuticals. And let's not forget those paid to practice politics. Lots of P's in here, but you know, I forgot one, and that's the people. P for people, P for the participants in our healthcare system, P for the patients needing and or receiving care. The purpose of our healthcare in the first place is to provide quality care to those folks. We must ensure focus on quality, and P helps us with that too, because historically there was a fellow named Deming, some of you may know him. He was responsible for the Infinities and the Hondas and all of that, an American quality guru. He defined quality as performance over price. So when you think about what we're looking for with quality, we're looking for superior outcomes for the lowest possible cost. That's what employers are looking for. We're hoping everybody's looking for that. So think about the letter P today as you participate in our summit and listen to our terrific presenters who will remind us and enlighten us about partnership, patience, and the performance and price of quality health care. Thank you.